Hello, my name is Laura and I'm a nursing student, and today I am going to be demonstrating how to give a patient a piggyback solution when they already have a primary solution hanging, and I'm also going to be demonstrating how to give a patient a medication through IV push. And I will be using my GPSP, my 11 rights of medication administration, and my 3 safety checks. So what we're going to do first is we're going to get that order from the physician, and we are going to gather whatever necessary supplies that we have. And then we're going to go to the patient's room, and we are going to provide for privacy, and we are also going to knock and then provide for privacy, and then we're going to use our 2 patient identifier and check for allergies, and we ask for date of birth and then check with the bracelet. So we're going to explain to the patient that the doctor has now ordered a new medication through IV, and it is going to be on a IV piggyback, and we're going to get permission from the patient because it is a medication, and we're going to ask if the patient has any questions or concerns or anything like that, and answer if the patient does. And we're also going to perform a focal assessment. For example, if it's, say, digoxin by piggyback, we're going to check for that apical pulse for exactly 1 minute before it is administered. But depending on what the medication is will depend on what type of focal assessment is going to be done. So once we have permission to proceed from the patient, we will proceed. So the patient in this scenario already has a peripheral IV site in their arm, and they're already getting a primary solution. And in this scenario, it is just saline, and that is the patient's primary solution. So we are going to give a piggyback of another medication. So what we need to do in this situation is we need to check the compatibility of that piggyback medication to the primary. Is there some kind of compatibility? Is it not compatible? These are questions that need to be asked and assessed before we even go and visit our patient. But in this case, we're going to say that it is compatible. So what we do now is, since everything's compatible, this is ivory tower, we're going to proceed with giving this patient the piggyback medication. So what we always want to do when we come in is we want to assess that site of the IV first and foremost. And we always want to check to see if there's any kind of redness or any kind of swelling or anything that is abnormal at the site of the IV. So what we're going to do first as we proceed is we're going to do our hand hygiene. So I like to do hand hygiene before I lay hands on the patient or any equipment that's going to have to do with the patient. So hand hygiene, and now I'm going to put on gloves. Okay, first what we're going to do is bring in our piggyback, and we're going to spike the bag. And we've already made sure this medication is appropriate, and we've already made sure, and that's done in our 11 rights, made sure it's appropriate for the patient. We did our focus assessment, and we made sure there was nothing wrong with the bag, made sure the color was right, and we also made sure that it wasn't expired. Now, when we spike the bag, we want to take off the caps. I'll do it down here. We want to take off these caps, and when we take off these caps, we want to make sure that we do not touch the tips, because that will contaminate the entire bag of solution. Take off the caps, and now using the push and twist method, you gotta push pretty hard. So push and twist and put them together, and that is spiking the bag. Now before we flip the bag over, we want to make sure that our tubing is clamped off, or else we could have a big mess. So tubing is clamped. We can now flip this over. So what we want to do is we will go ahead and hang this up, and because of where I'm positioned, I'm going to hang it up before I get all the air out. So we will take the cap off and very lightly we will drain it and get all the air out of the tube. That is very dangerous for the patient. If air is in the tubes, they can get an air embolism. Now, what we're going to do next is we are going to take the primary and we are going to clamp the tube in the primary line. Now, when we hook up the tubing to when we hook up the tubing of the piggyback to the primary line, we want it to be the junction closest to the bag of solution on the primary. So we take off the cap and we need to scrub that hub. And we are going to scrub that hub for at least 30 seconds. And then we let it dry. Okay, so now that that is set, we also are going to do this by gravity. So we are going to drop that primary bag down. Okay, so we also want to prime our bag here. Prime it. And all of our tubing is now appropriate. We have primed our tube. Our tubes are clamped. It is at the closest junction to the primary. Our primary bag is hung lower than our piggyback. And we have scrubbed the hub. Now, what we need to do now is we have already done our calculations for the medication of our piggyback. So we are going to make sure our calculations, we've already done that, made sure our calculations are correct, and we have made sure the drip rate is correct right here. So we are going to, this is already unclamped to make sure our drip rate is appropriate. So we are going to unclamp the main, and we now have medication running through. And we are going to make sure, let that hang, we are going to make sure that drip rate continues with the same flow that it should, okay, because this is a gravity system. And we're gonna check every 5 minutes or so and make sure that's still going at the same rate. And since it's going into the arm, we're also going to assess the arm as we assess the drip rate and make sure that the patient is not having any adverse reactions to this medication. So we're going to assess the arm, make sure the patient's not having redness or swelling or depending on the medication, they could be having red lines shoot up, just depending on what this medication is. So once the medication is done and this bag is empty, what we're going to do is we are going to clamp the line, working our way from bottom to top. We're going to clamp, and we are going to disconnect. Oh, shoot. Sorry. Now in a real world situation, that would have been an empty bag. Now, we're going to scrub the hub for at least 30 seconds. And we're going to put a cap on. And this is an empty bag, so we throw that away, we dispose of it properly. And now we are back to our primary medication, and we set it back to our primary location. Now, like I said before, this is a gravity IV. So we set this back to the calculated drops that it should be at. So we stand here and we open the tube, and we also make sure it's at the appropriate drip rate according to our calculations. Okay, and we will check on that every 5 minutes or so to make sure it is at the appropriate drip rate, and make sure the client or patient is comfortable, and make sure the patient is at the appropriate comfort level, the appropriate bed level that he or she wants. Make sure they have a cold light, and we're also going to assess that arm once again and make sure there's no redness, swelling, or anything of that matter. And we are also going to clean up our area, and most importantly, we are going to document and report and record. And let's not forget our hand hygiene. We are going to throw our gloves away, and we are going to sanitize. Now, that was a demonstration of our piggyback. But now what we're going to do is we are going to see how we do an IV push. Okay, we're going to see how we push a medication. So in this situation, you know, we've done a piggyback, and say later in the day, the physician has ordered for there to be just a simple a simple medication to be pushed in the IV site. So what we're going to do is we're going to do our hand hygiene. And put on some gloves. And of course, we went back into the patient's room and did our 2 patient identifier check for allergies, and we have also told the patient, you know, about this new order of medication that the doctor has ordered to just be pushed into his IV. Now, we will gather permission and answer any type of questions that the patient may have. So what we're going to do is when you push an IV medication into the patient's IV from the primary, you want to go at the junction closest to the patient, which is right here, okay? And you also want to make sure that the medication, once again, the medication is compatible with the solution that you're pushing. All right, so we're going to work from this junction right here. So I'll just say this real quick. The medication that you are pushing, you need to look up the calculations on how fast or how slow you can push that medication, because it's not going to be a fast push. It will be very, very slow. Okay, some medications you can only do like half a cc per minute. It's very long. So what we're going to do is we are going to clamp the line, and we are going to kink it like it's a garden hose, and we are going to take the cap off, and we are going to scrub the hub, and again at least 30 seconds, let it dry. And then I just touched it, so scrub it again, 30 seconds, let it dry. Now we are going to attach saline, and we are going to flush the line, okay, with 10 cc's. And remember, every time you flush and put anything in this arm, you look and assess that arm, and you look for any kind of swelling, any kind of redness, any kind of adverse reaction every time you put something in that arm. So we just did our saline solution flush. The next is going to be the medication ordered. So scrub that hub again at least 30 seconds. Let it dry. And now attach your medication according to the order and according to the calculations of the certain type of medication that is on the order. You will push it as slow as needed while looking at your watch and the milliliters on the syringe, and it will be very, very slow, guaranteed. Slow, 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 slow. And you could be standing here for 5 minutes pushing it very slow. So once that time is done, you will take the medication off. You will scrub that hub again for at least 30 seconds. Let it dry. Now, the second flush of saline solution, you are going to push this saline solution at the same rate that you pushed your medication. Rationale behind that is because you are going to have medication still in this line, so you do not want to slam this saline in that tubing, because you'll be slamming a trace of medication into that patient. So that second bit of flush needs to be at the same rate. So we're going to scrub the hub at least 30 seconds, let it dry. Second saline solution flush at the same rate as of the medication. So flush at the same rate, could be 5 minutes. Flushing very, very slow until time is up. Scrub the hub and then put that cap back on. Okay, and now you have just pushed a medication through the patient. So what you're going to do is, the whole time you've been doing that, you have been watching that arm for any kind of redness, swelling, any kind of adverse reaction. You're going to document that immediately, and you are going to come back in 15 to 30 minutes to see if the patient had an overall reaction. You're also going to check the arm for any kind of adverse reaction. You can't check that arm too many times. So document immediately, gather your supplies, gather your trash, clean up your area, perform hand hygiene, and you're going to document, report, and record. You're going to set your patient back to a comfortable position according to what they want, and you're going to educate the patient on how to have their arm positioned and things like that, so that their catheter doesn't get kinked or anything like that. So it's a good thing that you put that catheter in their arm to begin with, in their non-dominant arm. So once you've done all that, you have completed the task. So thanks for watching. Bye.